Hey, what's going on? Charles Austin here, and let's be fit forever. So, today, Saturday, as you know, we do these streams every Monday and Wednesday at 6 p.m. Central Time, and also Saturdays at 1 p.m. Central Time. Or today, I guess I'm at like 109 Central Time. But anyway, so today I did want to talk to you a little bit about the basics of chronic disease. And chronic disease is a topic that I tend to focus on quite a bit, whether I'm posting on Facebook, on Instagram, and especially with my live streams here when I do them. And so I said, well, let me go ahead and at least explain kind of what the basics are. And we'll kind of go over some of the most common types here as well. But as always, before we do, make sure you go ahead and subscribe to this channel, like this video, turn your notifications on so that you're always up to date with the latest content each and every time I stream. Okay, again, Mondays and Wednesdays at 6 p.m. Central, and also Saturdays at 1 p.m. But as always, let's go ahead and dive right in and get it rolling by kind of just talking about what chronic disease is, right? So, oh, they're doing it again, y'all. So, all right. So again, when you have the questions, make sure we're gonna do our Q&A uh, at the end. Uh, we do the Q&A at the end. Anywho, all right. So, um, sorry, y'all. Okay, sorry about that. So let's go ahead and describe exactly what chronic disease is, right? So if we basically define it here, it's basically a condition that they say it lasts 1 year or more. But the key word here that I use is ongoing, right? Ongoing attention, medical attention, ongoing limiting of activities, ongoing limiting of daily living, or some combination of all of those things, right? So basically, if we're talking about chronic disease, we're talking about something that is something that doesn't just happen one day. You don't wake up and say, "Oh, I got a fever today," and the next day you wake up, "Oh, feel much better." No, chronic disease is ongoing. It's something that we deal with, uh, over time, right? So some examples include things like heart disease, right? Cancer, diabetes. Like those are literally, as it says here, and I'm on the CDC, right? Those are literally the leading causes of death and disability in the United States. And as you can see, look at the amount of money, right? And this is something that, you know, doesn't get a lot of attention, right? I think one of the things we focus on too much when it comes to our health, right, is we just talk about, oh, I want to be thin or I want to lose weight. That's it. That's where it stops, right? We got to think about the fact that not only are we, we're having death and disability, right? And those are two things. Obviously, we know that all of our time is finite, right? That someday our time will be up. But we want to make sure that we have longevity as long as we can, right? And then also, this is the other thing that I always like to talk about: disability, right? If we are going to be on this earth and we're going to enjoy life, we don't want to be disabled, right? We don't want to have issues with our eyesight. We don't want to have high blood pressure, issues with our heart and our lungs, our lung function. We don't want to have issues with our blood sugar and metabolizing energy, all these different things that you can have, right? And then last but not least, look how much money it costs: $3.8 trillion annual in healthcare costs. And it's clear that if we were able to reduce the amount of chronic disease that we had in this country alone, yet alone the world, this money could go down by a significant amount. And then maybe it's possible that that money could go somewhere else where we actually need it, right? So as you can see, 6 in 10 adults in the U.S. have a chronic disease, and 4 in 10 have 2 or more. Think about that. Okay, so if you were to line up 10 adults, okay, 60% is going to have some type of chronic disease, right? Somebody's going to be diabetic, somebody's going to have heart disease, cancer, some other type of chronic disease. And then what's worse, if you lined up those same 10 people, 4 out of 10, 40% are going to have 2 or more chronic diseases. All right, so now we're talking about a situation where maybe that person is a diabetic and also has lung cancer. Or maybe that person has heart disease and is obese. Or maybe that person has breast cancer and also has type 2 diabetes, right? Think about the amount of disability and the amount of money that managing those conditions is going to cost over time, right? So that's basically what we're talking about. As we can see here, some of the major chronic diseases, as we've already talked about, heart disease and stroke, cancer, and diabetes. And this should be no surprise. If you watched 5 seconds of anything that I've ever talked about, you're going to know that I'm always going to talk about the things that we can control, right? So I'm generally not going to focus on things like genetics, right? Because why focus on something that you literally have no control over? All right. We were all born by the luck of the draw, and our genes are what they are. There's nothing we can do about our genes, right? But we can do something about the way our genes behave. We can do something about the way our body behaves. And this is what I'm talking about. Major risk factors for chronic disease include things like poor nutrition, okay, physical inactivity, excessive alcohol use, and what's not listed here is excessive prescription drug use. These are all things, tobacco use as well. These are all things that we can control and reduce our risk of having chronic disease. And if we do have to happen to suffer from it, we can make life much, much easier, right? So real quick, what are the leading causes of death in the United States? Well, here you go. Heart disease and cancer. You know, this is as recent as, 2020, okay? So heart disease and cancer, all right? And as you can see, stroke is up there as well. So diabetes, 100,000 people, all of these numbers can be down. They can all be down, right? But as you can see, we're approaching 700,000 people. All right, 600,000 people every year dying from heart disease and cancer, and not everybody has to, right? So real quick on heart disease, y'all. And I did provide a link to my video in the comment section. I'm sorry, in the description of this video. I did provide a link to my video on hypertension, which is related to heart disease as well. And I also provided a link to my video on eliminating diabetes without medication. So make sure y'all check those videos out as well. Links are below in the description of this video. But real quick on heart disease, y'all. Generally, there's not a lot of symptoms like with heart disease, but sometimes you may notice you're out shortness of breath, chest pain, things like that. Pain in your neck and jaw, stuff like that. Okay. Sometimes you may notice fluttering in your chest, but fluttering, anybody can have fluttering at times. So don't just think, oh, I had a flutter one day, I have heart disease. Doesn't mean that, right? Chest pain, shortness of breath again, right? But if we go down to, again, what are the main causes, right? If we go all the way down, right? This is a long, and I'll probably do a series on heart disease at some point as well. Here we go. This is what I wanted to get to. Of course, as we age, everything gets worse, right? That goes without saying. All right. Now, this part here about gender, saying men are generally at greater risk. That's basically because women have a little bit of protection pre-menopause based on the amount of estrogen in their bodies, and it increases after menopause, right? But men just generally have a greater risk, right? Family history, I shudder to talk about that one too much, because the main thing that we pass down in family outside of genes are traditions, right? And those traditions can include things like poor diet, poor nutrition, poor exercise habits, right? So obviously, as you can see, smoking, poor diet, blood pressure, all these different things, of course, that we are in control of, right? So real quick, I forgot to just at least explain what heart disease, right, is. It's basically a bunch of different conditions that could include issues with your blood vessels, issues with your valves. It can include infections. It can include defects you were born with, right? Heart rhythms as well. So some of those things do include things that we're just born with, but the vast majority of the time when we're focusing on heart disease, we're talking about that plaque buildup, that high cholesterol buildup, heart attack, stroke, that type of thing when we're talking about heart disease, right? So real quick, type 1 diabetes, what is that one? Well, this one used to be called juvenile diabetes, right? But basically, it's a condition where the pancreas produces little or not enough insulin, right? And insulin is something that we need in order to make sure that we can process glucose for energy, right? So it's something that all humans need. We have to have it, right? So our pancreas just isn't quite functioning properly. And one of the common misconceptions on type 1 diabetes is that it is just solely genetic. Well, that's not exactly true, right? There is growing and more evidence to show that, yes, type 1 diabetes is genetic, but we can also cause damage to our pancreas with our lifestyle habits, to where now we're developing type 1 diabetes, right? And now we've damaged our pancreas so much that it doesn't produce the insulin that it needs to, and now we're suffering from type 1 diabetes, right? So type 2 diabetes, real quick, what's the difference, right? This is, if you have type 2 diabetes, we're talking about a situation to where our body doesn't necessarily respond properly to insulin, and your pancreas is making more insulin than you can actually use, right? So that means we're eating too much of the wrong foods and we're causing an overproduction of insulin in our body. And over time, if you think about it, yes, could this possibly be a pathway to type 1 diabetes? Possibly, right? Because again, type 1 diabetes, our pancreas is not producing enough. When we go to type 2 diabetes, we're causing our pancreas to produce too much. And if we think about this over time, it's possible that we could cause damage to our pancreas, and now we're suffering from type 1 diabetes also, right? So risk factors again, okay? Where is it at? The same stuff is, and the reason why I reiterate these things is because they're so crucial, okay? They're so crucial to our overall well-being, right? Healthy eating plan, right? What else? Where is it at? Oh, did I miss the spot here? Where is it at? Well, if I go here, we're going to see the same risk factors. I'm sorry, I lost my space there. But again, risk factors, just like we listed here before, we're going to be looking at things like our diet, our family history. We'll be looking at things like our obesity, our weight, right? We'll be looking at things like physical inactivity, etc., right? So another one real quick I wanted to touch on was cancer, right? Because again, we went over the most common types of chronic diseases, things like heart disease, cancer, diabetes, right? So 13 most common cancers, right? We got things like breast cancer, lung cancer. This one's really just, due to both, a little bit of combination of the pollution in our environment, but also smoking habits, right? Prostate cancer, colon and rectal cancer. If we think about this one, this is almost directly correlated to high fat, high protein, low fiber diets. And if you think about that, that means you're eating lots of meat and cheese and you're not eating lots of whole grains, fruits, and vegetables, right? Skin cancer, bladder cancer, leukemia, pancreatic cancer, thyroid, liver cancer, etc., right? So there's more, but those are just 13 of the most common. What I wanted to focus on were breast and prostate real quick. Okay, so prostate cancer, right? What are some of the things that we can do again if we're trying to reduce our risk for prostate cancer, right? And obviously we're talking to the gentleman, right? And again, I've talked to so many folks over the years, counseling clients, doing workshops and different things over the years. And the misconception about cancer, and if we're specifically talking about prostate cancer, is that it's luck of the draw. It runs in my family. I just get it. It's not the case, people, right? So again, if we look at some of the things that we can do, if we're talking about prostate cancer prevention, right? What are some of the things we can do to reduce your risk? Okay. Well, here we go again. Low fat diet. Okay. So we want to make sure that we avoid things that include that contain lots of fats, and we're talking meats. I'm not necessarily going to put nuts on the list just because nuts are generally unsaturated fats. They're going to have lots of fiber and nutrition with it as well. But if you think about lots of oil, definitely dairy, milk and cheese, that kind of stuff. Okay, so definitely we're going to want to make sure we're reducing our intake of those type of foods. Again, increase the amount of fruits and vegetables you eat every day. Okay, so now we're talking about lots of vitamins and minerals, lots of fiber, all healthy things we need. Okay, and again, there it is. This is twice. This is how bad dairy is. This is how bad dairy is that the Mayo Clinic decided, let's go ahead and put dairy on the list twice to tell you not to eat it when it comes to reducing your risk for prostate cancer. Here it is right here at the top. Okay. We're trying to avoid these foods. Okay. And then here we go again. We want to make sure we reduce dairy. Okay. So again, make sure y'all check out my series on dairy is death. I've already made 2 videos, many more to come. So you can learn about all the reasons why no human on planet Earth should be consuming milk products and from other species, right? So obviously other things that include maintaining a healthy weight and exercising most days of the week, okay? So obviously these are all things, and you're going to see the same things keep popping up. So if you're wondering why there should be a larger push, but if you're wondering why there's always this push for everybody to consume these healthy, natural diets and lots of exercises, because it literally helps everything. Okay, it literally helps everything. If you can find me something, that a nutritious diet and regular exercise hurts, then I'll quit. I'll quit what I'm doing tomorrow. I'll never make another video. I'll never coach another client. I'll never do another exercise video if you can find something that it hurts, right? Last but not least, before I wrap up, before we get to a Q&A, y'all, what can I do to reduce my risk of breast cancer? Again, the common misconception whenever I have this conversation with ladies, right? And for gentlemen, don't think that you're immune from breast cancer. You're not, all right? It can happen to us just like it can happen to ladies, right? But it's more likely with ladies, right? So the common misconception, again, is that it's just something that runs in my family. It's luck of the draw. It's just something that may or may not happen. And that's just simply not true. The evidence says everything to the contrary. So if you're talking about many of the factors that you can do, yes, we know for a fact that everybody gets older and everybody does have different genetics, obviously. So for the last time, the vast majority of the time when I'm making my live videos, I'm not talking about genetics. We're talking about the things we can control, okay? So what do we see? Oh, what do you know? Healthy weight again, right? Exercise regularly. We're talking about reducing our alcohol if we're going to drink it at all, okay? So how do we maintain a healthy weight? We're going to have a nutritious diet. We're going to exercise regularly, right? So these are all the same things. It doesn't matter, okay? Oh, and it also, ladies, also, as it says here, you're going to want to breastfeed your children if possible. Now, we know that not everybody has the same experience when it comes to nursing their children. So by all means, if there's issues there, then we're not talking about you, right? But if it's possible and you have healthy lactation, healthy milk production, by all means, please breastfeed your children. It's better for you and it's better for the child as well, okay? So at the end of the day, ladies and gentlemen, okay, I know this was kind of a basic stream. You know, I don't have to always be complex, right? But I did want to make sure we explain what chronic disease is. So when you hear about it, so if you hear about it on the news, if you hear about it on TV, social media, your doctor starts talking about it, you can at least have a basic understanding that chronic disease is something that you're going to suffer with until you don't. And what I mean is, let's say you're a diabetic, we'll say type 2, right? Until you get control of your blood sugar, you're going to have diabetes. It's that simple. There's no twists, there's no tricks, there's no ifs, ands, or buts about it. Until you decide to make a change, you're going to have diabetes and you're going to suffer from that chronic disease, right? So last little misconception I wanted to go over is another one is that a lot of people believe that once they get a chronic disease, they have it forever. Okay, that's not true. Okay, so again, so many different examples: obesity, cancer. If you've ever heard the word remission, that means the cancer is gone, right? Diabetes and high blood pressure, high cholesterol, all these different things, right? Just because you've had diabetes for 5 years doesn't mean that year 6 you can't be free of it. Okay? Well, how do we get rid of it? We change what we're doing. I've had my own clients, my own success stories of where before they worked with me, they were diabetic. Once they worked with me and after, they were not diabetic. Very simple. Okay? So we can change these things. We can get rid of these diseases, but we have to do the work, right? And once you do the work, you got to keep doing the work, right? So real quick, like I said, wrap it up. Then we'll do a quick Q&A. Chronic disease, dangerous number. 6 in 10 adults are going to have some type of chronic disease, whether it be heart disease, cancer, Alzheimer's, different things, diabetes, all these different things, right? We talked about these are basically the leading causes of death in this country, heart disease and cancer. And if we go here, stroke is on the list, Alzheimer's, all things, diabetes, all numbers that we can drastically reduce if we start learning a little bit more self-control, a little bit more better habits when it comes to our nutrition and our fitness, right? So we talked about heart disease and all the risk factors associated with it. And generally, as we went through all of these diseases, what we noticed is that they all had the same type of risk factors, right? Whether it be type 1 diabetes, whether it be type 2 diabetes, whether it be different types of cancers. The overarching message here is that we have to take care of the things that we can control, and that's our lifestyle. That's our smoking, that's our drinking, that's our nutrition, that's our habits. That's what we do every day, okay? All right. Time for some Q&A. Time for some Q&A. All right. So I already had my one from earlier. Let me go back to that one. So you weren't even ready to talk about chronic disease. Why do I always get this question? What's the best way to train? And it's fine. I love answering this. There's nothing wrong with answering the same question, right? How do I tone and train my lower abs, right? So again, I think I answered this one the other day. But it is a common question, right? It is a common question. I'm gonna show you something real quick. So just pull this up. So anytime you want to focus on your lower abs, you want to do exercises where you're going to elevate your legs off that ground, right? So as you can see, what I did is I just typed in leg raise exercise. And as you can see in the images here that I'm highlighting, leg raises are a simple and basic exercise to help train your lower abs. It's not the only one you can do, but the point is, if you're trying to target your lower abs, you want to make sure you have your legs and/or your hips elevated off the ground. Crunches won't get it done. Sit-ups are literally the worst thing you could do for your abs anyway. It's bad for your back. So you want to do things where your legs are off the ground. Another good one would be like, let me see what this pulls up. Bicycle crunches, right? Yeah, this is another good one. So again, we have elevation off the ground. So that's one of the best things you can do. Train your abs, and also planks. Planks are excellent as well. Way to train your lower abs. So good question. Gotta love it. See if we got any more. So my mother has had diabetes for, sometimes I have, I'm sorry, I'm trying to read through. My mother's had diabetes for, I guess it's a certain amount of time. I don't know how long. Yeah. So, okay. So the question was, my mother has had diabetes for, I couldn't remember how much, see how much time it was, but can she so you're saying she basically was asking, so you're saying that you can actually get rid of diabetes. Why does my doctor keep giving me the same treatment or whatever? Anyway, so long story short, if you're wondering about being a type 2 diabetic, and you're saying, hey, I've had it for this many years, or a loved one, whatever, right? And again, I'm not a medical doctor. I don't know everybody's individual case. So this is not some type of blanket statement that says, oh, this is all you got to do. Everybody's different. But the overarching message here is that, for the most part, to answer your question, yeah, right? Just because you have type 2 diabetes today doesn't mean you're going to have type 2 diabetes tomorrow, right? Now, does that mean there's a magic pill that you can just wake up and take and your diabetes will go away? No, all right? I talk about this in detail in my video on eliminating diabetes without medication, right? And what is going to be the medicine we're going to give you? I don't know. Probably lots of regular exercise, regular nutrition with high fiber diets, low fat, low sugar, low added sugar diets with plenty of fruits and vegetables and high quality plant protein. That's the recipe, right? So if you're somebody that knows that you or somebody else is, hey, I know for a fact that I have diabetes, right? And if you're continuing to do these things, right? Number one, if you're saying that I'm going to continue to go ahead and say, well, let me just keep taking this medication and eat whatever I want to eat, because there's so many people that do that, okay? You're setting yourself up for failure, okay? Now, I'm not telling you to disobey doctor's orders and not take your medication, because again, everybody's case is different. What I am saying is that if you continue to rely on a medication and you're not going to change anything else, your life is going to be shorter and it's going to be painful, okay? So what you got to do is say, hey, I'm done with this medication. I'm done with all the medical visits and all the medical bills. What can I do? Well, here's the answer. I need to eat better and I need to move more, okay? Almost the solution for just about anything, y'all, okay? So good question, all right? I don't see any more. Like I always say, we do these streams every Monday and Wednesday at 6 p.m. Central Time. We also do them on Saturdays at 1 p.m. Central Time as well. I'm going to pull this up for y'all real quick. Here we go. There it is. There's my screen share video. So again, visit fitnesscharles.com, folks. You can follow me on Facebook. You can follow me on Instagram. You can follow me on Twitter. You can subscribe to my YouTube channel. All right. You can try 2 weeks of my 3 times to burn fitness program for free. Total body workouts. We use resistance bands. We use dumbbells, whatever works best for you. Comes with a nutrition plan. Comes with everything you need. All the workouts are pre-programmed. All you got to do is do them, right? You can try 2 weeks for free. And once you love it, not if you love it, once you love it, then you can get the rest, right? And also, again, getting ready to start doing a raffle for my Fit Forever family. This is my 12-week transformation program. So if you want to join into the family to figure out how you can transform your body, whether it's you want to lose 10 pounds, you want to lose 20 pounds, you want to tone up your body, you want to lose 30 pounds, whatever that number may be, whatever your goals are, joining my Fit Forever family is the best way to do so. So I'm getting ready to start a raffle. There's going to be some lucky winners that's going to be able to try this entire 12-week, we're talking 90 days, this entire program absolutely free. Okay, and we're getting ready for that launch coming up, so stay tuned for that as well. All right, so I will check y'all on the next stream. That'll be coming up on Monday at 6 p.m. Central Time. Until then, have a great week.